Hi viewers, welcome back. In today's video, we are going to discuss about the fetopelvic relationship. Okay, so why I'm taking this as a separate topic in the sense like before we enter into labor, we have to understand what is this fetopelvic relationship. So it is the relationship of the fetus with the pelvis or the relationship of the fetus with the mother's uterus. Okay, so this is your fetopelvic relationship. When you consider labor, you have to remember these areas of fetal attitude, lie, presentation, position and station. So these 5 factors, they determine the labor. So whenever you are having a presentation on your mechanism of labor, these 5 play a very important role. Okay, so we will discuss this, and in case if you have any doubts, you can ask me. So the first part is your fetal attitude. So what is this fetal attitude? Fetal attitude is the relationship of the fetus with itself, that is with the body parts of itself. So it is the attitude of the fetus. So you are going to tell whether the fetus is in a flexed attitude, non-flexed attitude, all these things you are going to tell. Okay, so usually what is the normal attitude of the fetus? It is going to be in the flexed attitude. How the baby will bend? How the baby will be in a C shaped, that is like in a bend shape like that. So all the hands and legs, it will flex, and the body also will be flexed, and the baby will have a flexed attitude, which is the normal attitude for a normal labor. If the baby is in a flexed attitude, what happens? So I said the baby will take a C-shaped position inside the uterus. So when the baby is flexed, the hands will be flexed, the legs will be flexed, and the baby will have a C-shaped position. So when it is in that position, what happens? The cephalic part, okay, this vertex part will be in the lower segment, which is going to be the first part, presenting part. So when it is going to have this, I said like the vertex, if it is in the presenting part, what will happen? The labor process will take place easily. Okay, in case if the baby is having a deflexed posture or otherwise extended posture. See, deflexed in the sense like if the baby is not having a flexed position, instead the baby is like this. So hyperextension in the sense it is like this. So if it is like this and all, like what will happen? It will not aid in normal labor. So what will happen? The baby will have a face presentation, a chin presentation, anything can be presented. So in all these conditions, the labor is going to be a delayed or prolonged labor will take place. Sometimes you may not even proceed into a normal labor. Okay, so then comes the fetal lie. So what is fetal lie? It is the correlation of the longitudinal axis of the fetus with the longitudinal axis of the maternal pelvis. Okay, so lie is, it is like longitudinal lie or otherwise transverse lie, like that you have to tell. Okay, so usually the baby will have a longitudinal lie, or like the baby, how the baby will lie down, the mother will, like now if I am standing position, so what will happen? I am standing, the baby is also in a standing position but in an inverted position. The cephalic presentation will be there. So that is like the longitudinal axis of the baby will be in the longitudinal axis of the fetal relationship. So that is called as fetal lie. In case if the mother is having a longitudinal lie, well and good, she will be proceeding into normal labor. There is no problem, she can go and progress. But in case if the mother is having a transverse lie, it is very difficult. She may not enter the normal labor process. Okay, she usually she will have complications during the labor, so better you take her for a LSES session. Okay, so the next area of your fetopelvic relationship is the fetal presentation. Okay, so fetal presentation is like you are going to tell the which part of the fetus is the presenting part in the sense like which is in the lower uterine segment. Okay, so lower uterine segment, like three presentations are very common. That is your cephalic presentation, that is the head of the baby, that is the presenting part, or otherwise it is the breech presentation where the buttocks of the baby will be in the lower uterine segment, or otherwise the shoulder presentation. Usually most of the conditions, that is around around 95% or otherwise like 90% also, there will be cephalic presentation. In some cases there are breech presentations. In very rare cases, maybe in 1%, there may be a shoulder presentation. So breech presentations, like in olden days they were having different methods of conducting breech deliveries, and they conducted, it was successful. Nowadays we are not ready to lose mothers and the fetus, like, so we don't want to take any risk. So when the mother is presenting with the breech presentation, we always encourage them to go in for a cesarean session, both for the safety of the mother as well as for the fetus. Okay, so you have to remember all these presentations of your cephalic presentation, then the breech presentation as well as the shoulder presentation. Then comes the fetal position. Position of the fetus is the, you are going to tell the relationship with the four positions of the uterus, that is your anterior, posterior, left side and the right side. So you are going to tell whether the baby is lying down on the left side, where is the spine of the baby, whether it is in the left side. So you are going to say, how do you say, it is the left side of the baby, left anterior posterior diameter, like that you will be telling. So either it is in the anterior side or otherwise posterior side, left side or in the right side. So depending upon the fetal position, you can tell whether the baby is in the left anterior posterior diameter or otherwise right anterior posterior diameter. So all these things can be explained when you are going to talk about this position. Okay, so positions are also playing a major role in conducting normal delivery. So the left occipital anterior or posterior diameter, the baby is very comfortable in getting delivered. So in case if it is in the posterior diameter, it is a little troublesome, or otherwise right side also okay. Other than that, it becomes little more complicated. Okay, so this is with your fetal position. So then finally coming to the station. So station is like, you are going to detect the where is the head of the baby. Okay, so you are going to assess with the ischial spines. With these ischial spines, you are going to detect where is the head of the baby. So you measure the ischial spine. Ischial spines are the sharp like protuberances which are present in the pelvic bone. Okay, so you are going to measure this diameter. Okay, so in between the ischial spines you are going to check and you are going to tell where is the head of the baby. In case if it is in the at the level of the ischial spine, you term it as 0. In case if it is above, then you term it as minus, and if it is below, that is like outside the ischial spine or otherwise the head is coming out, at that time you term it as plus. Okay, so you at the level of ischial spine it is 0, above that it is like 1 centimeter you have to go above that. So it is -1, -2, -3, -4, -5. And again coming down towards the outlet, it is +1, +2, +3 and +4. So when the head of the fetus is in the +4 diameter, it is in the outlet. You are able to see the head or the hair of the baby. Okay, so these are the 5 areas where you will concentrate during the labor process. Okay, so your importance must be on the position, presentation, lie, attitude and the station. Okay, so these 5 things play a major role in determining the normal labor of the baby. So now you remember this. In next class we will discuss about the labor process. Okay, till then take care, bye.